so injectables, otherwise known as Botox and fillers. And so we initially planned to give the talk and did end up giving the talk in March. But because of the situation with coronavirus, the talk actually ended up being the day before lockdown was arranged. And as such, not many people were able to come to the talk. So I'm quite pleased to be able to give that today. And thank you for taking the time out to attend that talk. So let's start with the presentation itself. So looking at the main objectives of this talk, basically this talk's aimed at dental and medical undergraduates, but also people who may currently or recently been graduating in medicine and dentistry. The aim is to provide insight into medical aesthetics, so specifically injectables, so botulinum toxin and dermal filler. Though happy to take questions on other aspects, whether that be surgical or non-surgical as well, when we come to our question and answer session. So we're going to have a think about some initial concepts with regard to injectables. And by that, I mean looking at a framework for how you assess a patient, for example, who may attend with a medical problem causing aesthetic issues, or someone who's not got any pathology, but simply wants to undergo some aesthetic enhancements. So looking at the outline of the talk, we're going to discuss what medical aesthetics is. We're going to talk about what regulation currently exists. We're also going to have a think about training pathways that exist for doctors and dentists. We'll have a look at the business side with regard to marketing, any rules and regulations that exist in that area. And we'll also come to some common treatment examples. I won't go into too much detail with the treatment on this talk because there will be further webinars. This talk is aimed at being a general introduction so that we give you a general overview and a better insight into the area of non-surgical aesthetics. Something I'm going to do in this talk as well that I didn't do in the previous talk is cover a little bit about COVID-19 and its effect on aesthetic practice, but it's also quite relevant in terms of, to a certain degree, medical practice, but also dental practice, very much so. So, what is medical aesthetics? Try and simplify this as much as we can. It's that area of medical treatment that's concerned with either treating pathology and trying to improve appearance, or purely treating appearance for cosmetic reasons, where there's no existing pathology. So for example, it could be a patient who has no diagnosed medical pathology, but would like an enhancement to a certain area of their face. Or it could be a patient who actually suffers with a medical condition, for example, acne, or psoriasis or eczema, and those groups of patients often seek help from medical aestheticians as well. We can divide medical aesthetics broadly into surgical and non-surgical. Those names are pretty self-explanatory. We're going to talk about non-surgical aesthetics today, and I'll explain why we're going to talk about that for a number of reasons. But importantly, when we think of surgical, we can think of surgery, so liposuction, nose jobs, breast augmentations, facelifts done in theatre. And then when we think of non-surgical aesthetics, so they're the treatments carried out outside of the surgical setting. We're going to talk mainly about injectables. However, when we talk about non-surgical aesthetics, we are talking about four main things. They are botulinum toxin, dermal filler, ablative lasers, and chemical peels. They're the main areas. There are some other things such as threads and also hair transplant treatment as well would be thrown into that now, although that's quite overlapping with surgical treatment as well. So there is some debate as to whether that belongs to the surgical side or the non-surgical side. But for the purpose of this talk, important to understand that we're talking about non-surgical aesthetics and we're talking about injectables, so botulinum toxin and dermal filler. So in terms of anatomy, I like to break this down into four main aspects. And if you can think of these four main aspects when you're thinking of injectable treatments, treating a patient who has an aesthetic concern, I think it simplifies things quite a lot. So moving from most superficial to deep, we start with the skin, which you can see in the top left-hand side of your screen here. When we think of the skin, obviously it's the largest organ in the body. It has many, many functions, thermoregulatory and barrier functions, and consists in the epidermis and the dermis primarily. And each of those can be further broken down into subdivisions. For example, the epidermis can have up to 5 individual subdivisions. And the dermis generally is divided into 2. We have the radicular and we have the papillary dermis. So that's the first area you need to really think about, and that is the skin. Next, it's important to think about the fat in the face. So that's the subcutaneous fat that exists mainly in defined compartments. And importantly, the fat in the face exists in a deep layer and a superficial layer, and it very often sandwiches muscles in between those. The importance of fat is that it provides volume, it provides contour to the face, and a young person's aesthetically pleasing face generally has fat in the right places, and that's why you have a nice round defined cheek area. That's why you have fat kind of more concentrated in the mid-face, whereas as you age, it will tend to migrate south, which is why you get lower face problems, such as lack of definition around the jawline and jowling. So fat is the next area that I want you to think of when you're thinking of assessing a patient's face. Moving in a clockwise fashion, we come round to the bottom left photo where we have muscle. So muscle is obviously incredibly important when we're thinking about aesthetics, and actually the most commonly provided and requested treatment, which is botulinum toxin, treats the muscle specifically. So that's usually the thing that most patients will know about. It's usually the first thing they'll seek treatment for. And thinking about the muscle is incredibly important because in the face, the muscles are responsible for movement, and as such, they'll cause initially dynamic lines, which is where we have lines that occur only on movement. So for example, elevating the eyebrow. And then we also have static lines, which are lines which with aging will start to become more permanent and will be present regardless of movement. And this is where the use of botulinum toxin really comes in. And it's really important to understand that these things shouldn't be seen in isolation. So we talked about the skin, the fat, the muscle. Now we're going to move around to bone. Really important that we think in all of those 4 things when we're looking at a patient. The reason for that is because when we're identifying a problem, for example, if a patient has volume loss in their face, which is the most common thing that happens with age, quite commonly the thing that's neglected is the bone. So people don't think about actually bone loss is occurring, so we need to replace that. What I really want you to understand is that you need to think in all of these 4 layers, and as we will come to discuss in this presentation and later ones, some layers should take priority. And you can probably understand I'm getting to the fact that identifying any bone loss is probably the #1 most important thing. And dealing with that will help all of the other layers in terms of the muscle, the fat and the skin. So let's take a look at why the muscle is important. We're going to have a quick look at a clip from one of our training videos. Okay. So we're going to just look at the area regarding muscle today, just because there's quite a lot to cover and I don't want to show you everything right at the start. So just an idea of how the training would be.
In this section, we move a layer down into the muscles of the face. We will discuss the role of muscles in the aging process and look closely at the action of the muscles, including as depressors and elevators. The muscles of facial expression are responsible for the enormous diversity of expression that humans are capable of. Whether it be sadness, happiness, anger, joy, fear, or surprise, the face is capable of expressing sentiments without a person ever having to say a word. The muscles are responsible for movement, and as such cause dynamic line formation, and eventually static line formation. The muscles of the face are, on the whole, superficial. The relationship of different muscles in different areas of the face to overlying and underlying flat compartments is important to understand. Most facial muscles can be classified as either depressors or elevators, and the contribution to certain appearances as part of the aging process can be understood in this context in many respects. The actions of the facial muscles can be appreciated by looking at any individual making facial expressions. It is interesting that individuals understand which muscles to activate when they are asked to create a certain expression. Let's look first at the upper face. The action of frontalis muscle elevates the brow and gives a startled or surprised appearance. Action over time can lead to the development of horizontal forehead lines. The glabellar complex involves procerus, which depresses the brow centrally, as well as the corrugator superciliar muscles, which are paired and move the eyebrows inferiorly and medially, creating oblique or vertical lines. It is important to note that orbicularis oculi is also a depressor of the brow laterally. The orbicularis oculi muscle squeeze the eyes closed, and the superficial muscle has a voluntary and involuntary part. This is a circumferential muscle, so its action varies, being an elevator of the cheek and a depressor of the brow. Action results in lateral canthal lines, also known as crow's feet. Many muscles are involved in the smile. The mid and lower face is extremely dynamic, and as such, any treatment around this area to address any perceived or actual sign of aging must be very carefully considered. Puffing out the cheeks requires the action of buccinator, as well as orbicularis oris. The action of orbicularis oris can lead to the development of perioral lines, for example with smoking, straw use, or playing a wind musical instrument. Making a sad face is possible through the actions of depressor anguli oris and mentalis. Mentalis overactivity can lead to a dimpled or pebbled chin appearance, while depressor anguli oris overactivity will draw down the corners of the mouth and may give a sad appearance at rest. Grimacing involves the platysma muscle, which along with the depressor anguli oris will draw down the back corners of the mouth, as well as depressing the soft tissues in the lower face around the jawline. Platysma overactivity can result in the formation of prominent platysmal bands with age, along with horizontal lines of the neck and jowling at the jawline.
Okay, it gives you an idea of, we're just going to cover muscle today, and then another time later in the talk we can have a look at some other stuff, some other areas of the teaching. Great. Okay, we'll pop back to the presentation. Okay. Getting the hang of Zoom as we go. Okay. Should be working. Okay, sorry about that. Some teething issues with Zoom. You can tell it's quite a new endeavor for me. So looking to the presentation again. So talking about the two main aspects of injectables, we had botulinum toxin A and dermal filler. Now, as I say, the desire is to go into the detail of all of these, and we could talk for hours about each of them. But today is meant to be an overview. And as we go on later in your training, you can find out more about obviously each of them. But just important, I really want to give you a general overview today. So a few important things. Botulinum toxin A is a neurotoxin. It's one of 7 subtypes of botulinum toxin. Importantly, a few things in terms of the language you use. So people often talk about Botox. In reality, Botox is just one brand of botulinum toxin A, but it was the first brand. It's probably the most famous brand. And as such, many people use those terms interchangeably, including myself. I do use the brand of Botox as well, but even people who don't use it often use it interchangeably with the term. So that's one important thing for you to notice. There are other brands, as you can see here. There's Bocature and Azalure. These are the 3 main brands that are used in cosmetics. And it's just a case of understanding their differences because they're not all equal, and getting comfortable with using one. That's botulinum toxin. When it comes to dermal filler, it's a little bit more complicated because dermal filler is such a a vast area, in that dermal filler can mean pretty much anything that we use to fill the tissues of the face, so from the dermis down to the level of the bone. Previously, 100 years ago or so, they started using fat. Then in the 20th century, they would use things such as paraffin, and obviously silicone has been quite famous for that, but those things are now not preferred because of the side effect profile, the risks involved, and the aesthetic outcome. And the three main types of dermal filler that are used are these ones that I've listed here. So number one, I put at the top, which is by far the most commonly used, is hyaluronic acid. And common brands used are Juvederm or Restylane. Then there are two other types which count for a very small amount of the market, but they are used by quite a few people. And one of them is a calcium hydroxyapatite filler called Radiesse, which is specifically used around the jawline. And then we have polylactic acid, which is called Sculptra, the brand. And that's used throughout the whole face as a collagen booster. Now, another important thing, again, not going into too much detail, but important to understand that with dermal filler, you can have two functions. They can be a volumizer, and they can also be a biostimulator. And often fillers have both functions to some degree, but usually a filler will have more of one function rather than the other. So for example, hyaluronic acid-based fillers tend to be volumizers, whereas calcium hydroxyapatite and polylactic acid, they do provide some volumizing effect, more so calcium hydroxyapatite. However, they also have a biostimulatory effect, which basically means that they will actually promote fibroblast proliferation and help the body produce its own levels of collagen and elastin, etc. So I'm going to answer, I see a couple of questions just come up. I'm going to actually answer them in a moment. Just when I get, I'm going to give us a break, and just if anyone's got any questions moving up, I'll answer them all kind of halfway through the presentation. Do prompt me if I haven't done that. So that gives you an overview of botulinum toxin and dermal filler. So hopefully that's just tried to simplify it slightly, albeit not a simple area, in that there are a huge number of brands. And even within, for example, just hyaluronic acid, which is one type of dermal filler, there is a huge variety of fillers, and those who are dentally trained here will have a bit more of an idea in terms of what I talk about when I talk about viscoelasticity and rheology. All of those things are really important when we talk about dermal filler, because it really does affect the properties and also how it should be used in the face. Apologies. Fine, so a brief overview of Botox. I've used the brand name here. Obviously, it's talking about botulinum toxin. So it's a neurotoxin which prevents acetylcholine release. And the way it does that, it works at the neuromuscular junction, and it works presynaptically. So it has a heavy chain and a light chain. The total weight is about 150 kilodaltons. And it's taken up by endocytosis at the presynaptic membrane. What it then does is that the light chain breaks off, and it basically destroys the SNAP25 complex. It's called the snare complex of proteins. And that is involved, as we can see in this diagram, of vesicles of acetylcholine joining the presynaptic membrane, budding into the synapse and carrying the nerve signal across the synapse and allowing the muscle to contract. So basically, botulinum toxin blocks that from happening. So that's really important if you understand. It acts presynaptically and prevents transmission at the neuromuscular junction. The result of this is localized paralysis, as you would probably expect. So it only affects the muscle which is supplied by that nerve. And importantly, it's not permanent. So that means once the effect has taken place, it will never last forever, because there's something called nerve sprouting occurs, where you get regeneration of receptors. However, it's important to always tell patients that once the effect is achieved, it cannot be immediately reversed. So it's not permanent, but it's not immediately reversible. And it's something which is a case of just waiting for time to pass if a patient, for example, doesn't like the result, which is in contrast to dermal filler, as we're going to talk about in a moment. So I'm going to focus on hyaluronic acid because it's the one that's used by 95% of people in consultations, etc. And This is a natural component of connective tissue. It's a glycosaminoglycan, and it's important in that it's intimately related to collagen and elastin in tissue. And it's demonstrated not that greatly by this diagram, but gives you an idea that the amount of hyaluronic acid will affect how cohesive collagen, elastin, and hyaluronic acid are all together. And really importantly, as well, it attracts and retains a huge amount of water. In vitro studies have shown that it can retain up to 1,000 times its own weight in water. Hence, it's the interest in its use, for example, in aesthetics for a long time. And importantly as well, it can be a volumizer and a biostimulator, similarly to what we spoke about before. And depending on the product, it may have a more volumizing effect or it may have a more biostimulatory effect. But usually every product has some degree of overlap. So in terms of the current market with aesthetics, we can see that it's worth a huge amount. I mean, these numbers are from 2016, since which time the market has increased even further. And you don't have to look far on social media or even amongst friends and family to know someone who's had aesthetic treatments done, or in your professional circles, if you're doctors and dentists, to know anyone who's providing these treatments. So it's a really huge market which is still growing. Importantly, things like greater social acceptance have meant that people, especially millennials and younger generations, are much more confident in terms of talking about what they've had done and who they've had it done with as well, which is obviously a source of referrals for people who provide these treatments. It's currently a minimally regulated market, and that has implications which we'll come to talk about shortly. Suffice to say, it's a huge market, as I say. 90% of all aesthetic treatments, remember we talked about non-surgical and surgical, of those, 90% are non-surgical. So people shifting away from having surgery done for a number of reasons towards these, what we call tweakments, so having smaller things done, which are perceived to be less invasive. And botulinum toxin is the number one, followed by dermal filler. So why the current shift? Many, many reasons, some of which you've already alluded to, but importantly, there are a few key things with regard to non-surgical aesthetics versus surgical aesthetics. And reduced downtime is a massive one. People always hear about these lunchtime kind of facelifts, walk in, have your lips done and walk out, go back to work. That's a slight exaggeration because there is definitely some degree of downtime with treatments, some a lot more than others. But certainly for some treatments, for example, if you're going to have upper face botulinum toxin, which is by far the most common procedure in the world in terms of non-surgical aesthetics, after about 20 to 30 minutes, provided the procedure went okay, you look completely normal. And as long as you're able to adhere to certain instructions afterwards, you can go about your usual your usual daily work, depending on what you do. Other important thing is that there are less drastic changes. And this is quite important because if you opt to have, for example, a nose job, this is quite a common example, it has to be a very, very reasoned decision. You need to think about the consequences, about how it will change your face. It's quite common that patients actually want to have a non-surgical rhinoplasty, so having filler to their nose, which we can look at in later webinars, because that gives them an idea of what it will be like beforehand, and it's not such an irreversible step as having a surgical procedure. Cost is another reason, although I say that with that caveat because some non-surgical procedures, especially if you're having quite complex and comprehensive treatment, for example, an older patient who needs full facial revolumization, that can get quite pricey, especially depending on the practitioner. So cost can be a positive why people are accessing these treatments. And certainly if you want to have your initial treatment, for example, botulinum toxin, or if you want to have a single area treated, for example, a lip treatment, the price is far, far below anything that would be done surgically. Procedures are much more accessible. It's really important. Many, many providers of treatments now, not necessarily a good thing, which again we'll come to later, but very, very accessible. And that accessibility goes through to social media as well. And that, again, especially if you're in healthcare, specifically within dentistry, but also medicine, you'll see people who may have graduated a few years before you, and they have got their own social media pages where they're promoting the work they've done, lots of befores and afters. So obviously the perceived outcomes of treatment are high, in that people will obviously only publish their good results. So all of these things contributing to quite a clear and important shift. So what regulation currently exists? Something which I've alluded to slightly beforehand, in that there's minimal regulation in the market, but let's have a closer look about what exists. So importantly, injectables are not covered by any specific regulation or legislation, any specific legislation in this country. What that means is that any individual can legally inject in the UK. Now, I know some of you, a lot of you, most of you probably will find that quite shocking, but that is the current state of play in the UK, which I find still shocking, unfortunately. But it's important that you understand that, because it will help you understand where the direction of travel is for professionals such as doctors and dentists who obviously want to improve that situation. Importantly, dermal fillers are not prescription medicines. So POM is prescription only medicine. They're classified as a medical device, which means anyone can buy them and anyone can inject them, as we've already alluded to. So again, they are completely without the framework of prescription medicine. There is some de facto regulation, for example, with regard to prescription medicines, which would include botulinum toxin. So because you need to write a prescription for that, it is covered by some degree of regulation. And as such, some regulation is introduced into the process of where a patient seeks the treatment, has it done. However, that said, there are some clear rules and laws regarding this, for example, regarding remote prescribing, which is illegal. However, this still goes on to a quite high degree. I mean, there have been some media reports in the past where they've exposed doctors and dentists prescribing nurses who were doing this over the phone, but the law states that the consultation with the prescriber must be face-to-face. So again, another really important aspect of dealing with any prescription medicine such as Botox that you should know about. So these photos obviously going to provide you with some shock value, but it's important that you see them because there are clear reasons why regulation should be in place. Firstly, you need to decide whether these are medical procedures or not, and they undoubtedly are. And being medical procedures, obviously, you need to think about the consequences of things when they go wrong. And this is where the current regulatory framework is very lacking, in that anyone can inject. Many people, well, everyone can obtain the dermal filler without even a prescription, and the results can be catastrophic, especially with dermal filler, which is the irony of the situation, that it's not a prescription medicine, but it can cause worse side effects. So here we have an example of severe swelling. This could be angioedema, it could be an allergic reaction, or it could simply be too much product put in. And when a lip swells to this degree, the thing you really worry about is any vascular compromise to the lip. So I'd be extremely worried if, for example, initially there had been some venous compromise, which is subsequently causing vascular compromise, or if purely due to the degree of the swelling, the patient was subsequently going to get vascular compromise. And vascular compromise is by far the most worrying thing that can happen, as well as blindness, which is to a degree the same thing. But they are the most worrying and troublesome consequences of dermal filler. I'm not saying that these can't happen even with good practitioners. They can. They're still very rare. But if you do enough procedures, this may happen to you. But the important thing is knowing how to recognize it and to treat it, because if they are recognized and treated, then the patient can make a complete recovery. If it's not recognized and treated, the patient can end up with lifelong scarring and, in the worst case scenario, blindness. Here's a particularly severe case. I mean, these images I found on the internet, and this case shows what's likely an intravascular injection during an injection to the nose, or possibly to the facial artery as well. This demonstrates a really important point, because we can see why anatomy is so important, because the fact that there's been an injection somewhere in the nose, which is possibly the dorsal nasal artery, possibly the facial artery, we know that those vessels, the dorsal nasal comes from the internal carotid, and which is the same source as the vessels which supply the glabellar region, which I'm pointing over to the precursor now. So the vessels here and here have the same source, so any vascular occlusion there has the potential to affect all of those areas. importantly, so does the eye. So the central retinal artery also is supplied by the ophthalmic artery, which comes from the internal carotid system. So here, here, and here all have the same vascular source here. It's really important that you understand that. And again, as we go through, we can look more closely at the anatomy. But by noticing these changes and noticing the pattern, the practitioner should know immediately this could possibly be vascular occlusion, and therefore I have to do something about it. And again, here's another example, which to me is more likely to do with the facial artery. So let's think of anatomy again here. We know the facial artery comes from the external carotid artery. It branches around the lower border of the mandible, just anterior to masseter muscle here. And then it ascends in a supromedial fashion. And it branches off to give the superior labial artery. And then up here, it also branches off to give the lateral nasal artery. So likely that the facial artery has been affected here, but it's also possible that the superior labial artery has been affected due to a lip infection. And really concerning here, we can actually see necrosis. You can see the black here, which means this lip has been left and this nasal alar has been left for too long. And this patient will undoubtedly have lifelong scarring. So changing attitudes in aesthetics. There are changes afoot to some degree. There was the KEO report, which is a government commissioned report in 2013 looking into cosmetic treatments. And that made a number of recommendations. Number one, importantly, it talked about dermal filler as a crisis waiting to happen. And really importantly, out of those recommendations, Health Education England then went on to publish guidance in 2015 about cosmetic interventions. And it made it's quite comprehensive guidance. Unfortunately, it's not mandatory. So it's some kind of advisory recommendations. But people who act outside of the guidance are not subject to any penalty. And it made a few recommendations. For example, it talked about the people who should be doing these treatments, which include doctors, dentists, and nurses, among a few other healthcare professionals. And it also recommended that all professionals should perform these treatments at a level 7. What level 7 means is that they should have carried out a postgraduate level qualification in that area. And there is a level 7 certificate which came out of these recommendations that is now provided by aesthetic trainers. Level 6 basically means a healthcare qualification such as dentistry, medicine, or nursing. So anyone who then graduates from those degrees is then eligible to go on to perform these treatments. So another important aspect to regulation is that the CQC does not govern the provision of aesthetic treatments, so non-surgical aesthetics. And the main source of regulation is via professional bodies. So for example, the GMC, the GDC, and the NMC. Optional registers do exist, and these include SaveFace and the JCCP. But again, these are not mandatory, so very much something which practitioners can choose to do. It makes them look better, obviously, if they do it in the eyes of the patients and in their colleagues, but still not arriving at a moment where we have to have certain regulations, certain standards of practice, which is unfortunate, but I believe we're moving in the right direction. In terms of international perspective, we can think of the way that regulation is different. I believe that the UK has one of the weakest regulatory frameworks in the world for aesthetics. And when we compare that to, for example, France and Spain, where only medically qualified professionals are allowed, in Brazil, where both medics and dentists are allowed, but not nurses and not anyone else, and in the USA, where medics are allowed everywhere, dentists and nurses in the majority of states. However, within states, there is some variation. We compare that to the UK, where there is no actual law preventing people from injecting. We realise how deficient our system is here in the UK. So, what training pathways exist? Training is a vast and complex area, which again, we can't cover in too much detail here. But suffice to say, when you're looking at any training options, it's important to think about a couple of things. Firstly, do you want to carry out a regulated training option? That means it's regulated by Ofqual, which is the educational regulator in the UK, or a non-regulated option. Next, do you want to gain academic accreditation? So when a course says that it's accredited, do they mean that it's academically accredited and that you will gain academic credits at the end of that qualification? For example, a postgraduate certificate or a postgraduate diploma? Or does the accreditation refer to CPD accreditation? It's important that you understand the differences and that you understand what you're signing up to when you do a course. It's not to say that there aren't benefits of each. Obviously, academic accreditation is different to CPD accreditation. CPD accreditation is more to provide an update to your current skills, whereas academic accreditation would be actually providing you with a new qualification, and you would leave that qualification with new skills. Important things as well, thinking about the credentials, experience and expertise of the trainers you'll be working with. Also the format and quality of the learning material. Is the learning material a document sent out? Is it interactive? Is it online? Is it video, tutorial based? You need to think about what kind of learner you are and how you're more likely to succeed in a distance learning fashion. Other important things, is it going to be focused on more hands-on training or classroom based? Definitely you should towards hands-on training experience, because you want to practice what you're going to be doing in real life. And also, are they going to be live models or are they going to be mannequins? And again, I would advise going to a course where there are live model patients for you to practice on. This just lays out some of the things I've already discussed in terms of regulation and training. We have the two main areas, which are non-regulated, non-accredited, and off-board regulated, academically accredited. At the moment, the only qualification we have that provides that level of regulation and accreditation is the level 7 certificate. That's not to say that you should only do that qualification. It is a superior qualification in terms of what you get from clinical experience, from the level of knowledge you'll gain from the learning material, because it follows a modular-based approach. It follows a syllabus that is standardized, that's externally accredited, and at the end of it, it's a nationally regulated and recognized qualification. On the other hand, historically, the majority of courses were non-regulated and non-accredited, and they still are, to be honest. And they consist in, for example, foundation courses, where you may do a one-day course learning how to inject botulinum toxin and dermal filler in a few key areas. So important to understand the differences and what course may be right for you at which time. When we look at the level 7, which is the regulated qualification, it has 4 main aspects. So it does actually contain the foundation course as the first step. You then move on to learning material, and therefore it's important to understand how the learning material will be presented. And you'll have 8 modules to cover, which will include dermatology, anatomy and physiology, botulinum toxin dermal filler, ethics, and consultation skills, among other things, but it's a very comprehensive approach. You then have training days where you attend, you build a portfolio by injecting patients under supervision, and then you have assessments at the end in the form of coursework questions and an OSCE. So training is largely delivered by independent providers. It's really important just to do your research, as I've said a couple of times, and really interrogate providers, ask them about the structure of the course, what will you get out of the course, because obviously it can be quite a big investment in terms of what you do. And it's important to consider that investment in view of a regulated course, which may cost more at the start, but then may hold you in better stead for the future. Most of all, have a really clear plan with objectives. Fine, maybe a good moment to take some questions. So I'm just going to have a look at those, grab some water. Okay, so first question is, are calcium hydroxyapatite and PLLA semi-permanent or permanent? They're referred to as semi-permanent fillers. So that's a really good point from Stephen, in that we talk about fillers in a number of ways. You can divide them based on their content. You can divide them based on if they're permanent, semi-permanent, or non-permanent fillers. And calcium hydroxyapatite and PLLA are semi-permanent in that they last longer than other fillers, and also they have a biostimulatory effect, like we said, in that they will actually continue having an effect even after the filler itself is gone. Also, importantly, they're not reversible immediately. With hyaluronic acid, there's an enzyme called hyalase, which you can use to dissolve the filler in the event of a complication, whereas with those 2 fillers that we've mentioned, they aren't reversible. Next question that's been put up is, would you use multiple fillers together? When to use Botox versus filler? Okay, so 2 questions there. So would you use multiple fillers together? You can do, definitely. I don't tend to, mainly because I generally just use hyaluronic acid fillers anyway, because within hyaluronic acid, you can achieve everything you want to achieve, and in my opinion, in a safer way, because it's reversible, and I understand the properties of hyaluronic acid, it's handling much better. But you can absolutely, for example, you can have a treatment where you provide a deeper filler to volumize the cheekbones, and at the same time, you might provide a more superficial filler to the dermis with the aim of hydrating the skin and also biostimulating. So yes, you can provide different ones at the same time. When to use Botox versus filler, that is the $64 million question. That basically is the most important question to get out of your aesthetic training. I'll try to answer it here, but I'll also try to answer it as we progress through the webinars. But importantly, it comes down to those layers that I mentioned before, which are the skin, the fat, the muscle, and the bone. Botulinum toxin is purely for the muscle, so it will only act because it paralyzes the muscle. However, it does interact with the other ones importantly. Whereas filler can be used in the dermis for the skin, it can be used in the fat, very useful in the fat actually, and definitely it can be used at the bone level as well. So botulinum toxin is to relax the muscle, whereas dermal filler is usually to volumize the tissue. So hopefully that answers your question. And then we've got another question about skincare products and hyaluronic acid being really good at retaining moisture. Is this how it is a volumizer, by retaining more water? Yes, basically. So it retains water to a huge degree, but also in addition to that, as I mentioned nearer to the start, it's action with regard to collagen and elastin, in that the way that collagen and elastin associate themselves with each other, stay together and stay firm, and also retain water themselves, is through hyaluronic acid. So hyaluronic acid basically promotes all of that water retention by bringing the water into the natural proteins that are in your skin already. Also, as we mentioned, it can have a biostimulatory effect, which promotes the fibroblasts to produce endogenous hyaluronic acid. Hopefully they've answered a couple of questions. Fine, so let's look at practical aspects of business in aesthetics. If you have any other questions, do write them as you go along and we'll answer them again, either on the way or at the end. So a few things that I think are recommended, and there are some differences between professions, which we'll come to shortly. But for everyone, I think it would be a good idea to set up a limited company. This can be done quite easily by a company's house and quite cheaply. Usually it's easier to do via an accountant and done quite cheaply. And you can speak to anyone about doing that. I'm happy to give informal advice about that as well if anyone's got any questions. That's useful for a number of reasons, because you're going to be dealing with clients who are going to be paying by card. You're going to have ingoings, outgoings. You're going to be paying possibly for rent for places. You're going to be buying a lot of products. So it's much better to do that through the route of a limited company rather than just personally. Other things to think about are product sourcing. So you need to think about which pharmacy you're going to use. And there are a number of aesthetic pharmacies. Importantly, it must be one of the dedicated aesthetic pharmacies to provide these products. You can't just go to any pharmacy such as a Boots or your local pharmacy. Next up, indemnity, obviously incredibly important. So part of the kind of Medical Protection Society or the DDS, any protection society that you usually need to practice within your profession is important. But beyond that, you also need what's called malpractice cover. So you need your indemnity to practice as a dentist, doctor, or nurse, and then the malpractice cover specifically covers the practice within aesthetics. It's also important to know that that is provided by specialist providers. So I've given 2 examples down here who provide this malpractice cover, and they provide specialist cover, so they know exactly what you're going to need cover for, and because it's what they do, they provide it a lot cheaper. So I definitely recommend you looking at those companies if you're going to do a course, and then obviously think about starting practice. When you do a course, do make sure that your course is affiliated with a malpractice cover insurer. And these 2 listed are the 2 biggest in the country. So make sure that your course is working with an affiliated company that you can work with as well. And then other things to think about are marketing and advertising standards, really important. Turning to profession-specific points. So we have doctors, we have dentists, and we have nurses, which make up the majority of people practicing. I think I'm just going to talk about a couple of things here, just in that some specialties, some professions have greater ease at moving into certain areas. So for example, we have dentists who are going to be working in a practice setting to start, which means they'll likely or possibly have some accommodation where they can carry out their treatments in a very appropriate setting. On the contrast, if you're an F1 doctor or an F2 doctor or beyond, and you studied medicine, then you don't have that immediately at your fingertips. So challenges and benefits from either side. Other things, doctors and dentists are going to be prescribers, and that's obviously helpful for them, whereas a nurse isn't immediately a prescriber. However, some professionals can go on to do prescribing courses and things like that. There's been a surge in some questions. So I'm just going to do this last bit on marketing because it may create some more questions and then we can answer those. So in terms of marketing, I would direct you to the Advertising Standards Authority. And they do have quite concise documents basically explaining what is and isn't permitted. Now, most people don't adhere to these, unfortunately. That's not to say that you shouldn't adhere to the rules set out for advertising. And social media is probably the biggest culprit in terms of where people don't adhere to these things. Now, it's a difficult balance between obviously marketing your services, getting your name out into the market, and also following rules and being professional. And as doctors, dentists, and nurses, you will be obviously subject to professionalism and probity. So really important that you know what the rules are. But certain things, rules include, for example, not allowing any advertising of any prescription medicine. So you're not allowed to advertise the name Botox or botulinum toxin or anything that's prescription medicine. That's a law in this country, regardless of the medicine. Stark contrast to countries like the USA, obviously, where medicines are advertised everywhere, but this country is very different. We're not allowed to advertise medicine names, and you're not even allowed to infer it. So some people try to get around it by writing Butox, so kind of a spin on Botox with putting beauty in it. Again, that's not allowed either. Other things, anything that's deemed to be coercive is not allowed. So any time limited offers, come and see me for lip fillers, buy next Friday and I'll give you a 20% discount, not allowed. Again, another thing. And also before and after photos are very much frowned upon as well. In fact, I don't believe they're allowed as of most recent guidance. So just look quite carefully into all of those aspects before you start any marketing via social media. Good, so this is the moment to look at some more questions because I think there are quite a few. And then we're going to have a look at some videos and the treatment examples. So this is kind of very much the more interesting part. Okay, so. Okay, so I've got a question. So just wondering, as a dentist, how would you incorporate aesthetic treatment for patients into your job? Would you advertise it via the practice you work at? Okay. Now, I've said this a few times. I'm really sorry with this caveat, but because this is obviously quite a constrained talk, I could talk about this for a very long time, and I would happily talk about it for a long time. So I'm going to try and be really concise. There's so much in terms of practitioners that I've worked with and trained before, and colleagues as well. There's a lot we can talk about. But in summary, you absolutely, I think in your dental foundation, it's probably a bit more difficult to do that. But if you subsequently go on to be an associate working in dentistry, which could potentially be a year after you graduate, then absolutely you need to find out what is going on in your local community, do some market research, see who's offering treatments, and then you have that discussion with people in your practice. Most dental practices who aren't already offering these treatments jump at the chance of having a practitioner who can offer those treatments. I mean, that's the case with a number of people who I've worked with, where they've actually gone to do training because their practice was very keen, they were happy to accommodate that person in the practice. And then obviously you've got all the additional bonuses in that you can actually advertise in the practice if the partners are on board. So you can put posters around, you can gain clients, contact people that way. So again, the answer to that question is probably, and you probably should if you can, as long as you're doing it in the right way, but that's very much a conversation for whoever you're working with and your partner. But I know that's definitely been a successful way for a number of people. Next one, how can you stand out as a medical practitioner offering aesthetic treatments versus other people who can do this and you haven't had much training? Again, a question that we could debate and talk about for a very long time. I think you need to set yourself apart by keeping standards high. And I mean that with regard to everything that you do in terms of your marketing, in terms of your training, and obviously talking about your credentials, because you will have credentials which other people who aren't medically trained will have. And really join campaigns, make sure that you're promoting safety, make sure you're raising awareness about the complications that can occur, and just stick to the principles that you've been trained as a doctor or a dentist or any healthcare professional, because the training has professionalism at its very core, and people who follow those principles in aesthetics. And it can be tempting to not follow those because you'll see people offering this, offering that, doing this price, not following the rules. But you don't want to get involved with that. You need to stay above the crowd by staying kind of within the group of medical practitioners and making sure that you're following the regulations and the rules, and you're highlighting your credentials and your safety credentials. Okay, so had a similar question again about that with regard to competition. So from experienced plastic surgeons and dermatologists. I think the market is so huge, and the proportion of providers who are, for example, surgeons and dermatologists is actually quite small and quite low. So I wouldn't worry too much about directly competing with, I don't know, a celebrity surgeon on Harley Street or a celebrity dermatologist who has treated celebrities and has that on their social media page. Because it's such a huge market that so many opportunities exist for you to have a professional career in aesthetics, for you to talk at conferences, for you to write papers, and for you to provide treatment, set up clinics, work with other people underneath you. And there are a number of examples of dentists and doctors who are, well, for example, dentists, number one, or doctors who have not trained in a specialty, or have perhaps done something not surgically or dermatology related, perhaps general practice, who are running successful, very profitable practices now. So there are definite ways where you can gain a competitive advantage. And again, it's something that I'd be very happy to talk about in more detail at a later date. The regulatory body, Stevens asked, is the Advertising Standards Authority, the ASA. And I've just highlighted that slide for you now again, actually, that you can see on there.
The aesthetics consultation is incredibly important and will determine how successful you are as an aesthetic practitioner in reaching your patient's treatment objectives. Here are some important points. Firstly, always ensure that the patient's hair is tied back away from their face to enable full facial analysis. Next, promote open communication and a relaxed environment with your patient. This will enable you to create an individualized treatment plan. Using an aesthetic interest questionnaire may be helpful in this regard to find out why the patient has decided to seek treatment now. Deciding between the patient's wants and needs is also very important, the latter being your objective assessment of what the patient requires. And finally, it's important to take photography at the start of your assessment. Full frontal, oblique, and lateral views are required. Okay, Juliana, can you just highlight to me the area of concern?
Around my eyes.
Okay, fine. What is it in particular that you don't like about that?
It just makes me look a bit tired.
Sure. And do you find that's the case even when you're well rested and hydrated?
Yes.
Sure. Okay, fine. And any other area of concern? As part of the aesthetic consultation, there is a move towards a holistic and a pan-facial approach. There is also a move away from individual issues which may be highlighted by the patient. There are 4 key areas in assessment and treatment planning that should be covered. These include geometrical facial assessment, an appreciation of sexual dimorphism, analysing the illumination of the face, including hollowing, contours, and the skin, and discussing the patient's own perceptions of their motivations. For example, do they want to look less sad or less tired? One of the 4 key areas in assessment and treatment planning in the aesthetic consultation is making a geometrical facial assessment. It is crucial to assess the underlying facial skeleton first. It is helpful to imagine a tablecloth and a table. If the table shrinks but the cloth stays the same, there is a need to increase the underlying structure first before we go on to address the skin issue. Another important approach is to divide the face into facial thirds, the upper third being from the hairline to the glabella, the middle third from the glabella to the subnasale, and the lower third from the subnasale to the mentone. Ideally, the facial thirds should be equal in length and in dominance and strength. Symmetry should also be assessed, and the aim is to reduce asymmetry, but perfect symmetry is not necessarily more attractive. It is also important to consider an artistic facial assessment. We first look at animation from the front, asking the patient to activate their facial muscles. We then rotate the patient to the side, this being the way that most of the world will view them. And then we ask the patient to tilt their head forward, tilting down to allow the effect of gravity to be seen on the tissues. Another key area which needs to be assessed as part of treatment planning is a consideration of sexual dimorphism. The degree of masculinization or feminization sought must be considered, and the treatment provided must be appropriate with this in mind. We can see the differences between a masculine and a feminine face here, obvious differences being the zygomatic area, the overall shape of the face being V-shaped in a female and more square-shaped in a male, and also the degree of size and definition in the mandible and the chin. So can I just confirm your...
So, gives you an idea of what we talk about when we're talking about aesthetic assessment and consultation. Let me just pop my video back on. So hopefully you found that interesting kind of as an initial assessment. So it's good to think about the geometric assessment. So kind of thinking of numbers and science when you look at someone's face. Always think about the artistic side as well, but make sure you get the geometric side right first for you to then be able to employ your artistic side, which is also really important. And then also consider sexual dimorphism. So important and so commonly overlooked by practitioners who perhaps can give the wrong result to a patient. There is a conception among many people that big lips, high eyebrows, big cheekbones are good regardless of sex. No, it needs to very much be in the correct context for what that patient wants to achieve. Obviously, there may be patients who, well, of all kind of transgender patients, someone who might want to appear in a different way, that's fine. All you need to do is establish that that is what that patient wants. Whereas if you have a masculine patient, a male patient who says, I want to look more masculine, and you make his eyebrows go high and you make his cheekbones bigger, he's not going to thank you, and that's not going to be what he achieves. So you need to really understand exactly how to get that result for your patient through an understanding of sexual dimorphism. Okay, so let's have a look here at this patient. So I like to think when I'm thinking of consulting with a patient in terms of a few things. So number one, what the patient wants. So that's subjective in my view. Number two, what the patient needs. And that's your objective assessment of what the patient requires. And that needs requires understanding of anatomy and morphology of facial aging, because you only know what the patient needs by knowing, for example, where they've lost volume, what are the ideals for a feminine face at this age, for a masculine face at this age. But obviously the patient wants is really important. Otherwise, you can't just go walking around to people you see on the tube and analysing their face and saying you need this done. Obviously it has to be a two-way street. So the patient may come and say, so for in this case, Juliana, as you saw in the previous video, she mentioned a couple of things about around her eyes and her mouth, and patients commonly do that. So that's kind of what her wants are. And then needs are the assessment that I carried out on her, what I thought that she required. And in my view, looking at her face then and obviously now, the first thing that strikes me is the mid-face. So the first place that I would always look at in a patient, especially a female patient, is around the maxilla and the zygoma, because bone loss and fat loss in that region is the first and key part of facial aging. And it happens in everyone. It happens in people who are in their 20s, and obviously progresses as we go by. So again, that's where your understanding and knowledge comes on board. You take an objective assessment of the patient, looking at symmetry, looking at facial thirds, looking at vertical fifths of the face, looking at how feminine they are, looking at where there may be a deficit, etc. Okay, So we've gone through patient wants and patient needs. The last thing we need to talk about is what's kind of known as patient feels, and it's also known as emotional attributes. Now, when we talk about emotional attributes, we're talking about how a certain appearance makes a patient feel. Because as we talked about earlier, and in the video I showed you, the face is responsible for so many emotions. And very often we may convey an emotion when we're actually feeling fine. This is often the case with older patients. Quite common you get an older female patient who will say that they're fed up of looking sad when they feel tired, when they feel happy, sorry, or tired when they feel like they've slept well. And they're really common things, but there are many, many ways that the patient can feel emotionally because of their appearance. And it's important that you get to the bottom of that. And this is what I try to do here in terms of looking at the patient wants, patient needs, and I put the patient feels. I've tried to ask her, how does it make you feel though? Kind of these bags under the eyes, or feeling like you've got more pronounced nasolabial lines, and come up with a couple of points, come up with a couple of achievable points, and they can be enhancing characteristics or downgrading characteristics. By enhancing, I mean, for example, I want to look more feminine, or I want to look more youthful, as is the case here. Or they can be downgrading, so I want to look less tired, I want to look less saggy. So they're examples of things. And so we reached that basically treatment plan by understanding the morphology of aging, understanding anatomy, but also really getting to know your patients. And aesthetics has a bad reputation where people may just appear on Harley Street and get on a chair. The doctor or dentist might even talk to them and just do their Botox, and that's really not the way forward. It has to be a really in-depth conversation with the patient. So I think next up, we're going to come out of here because we're going to have another look at another video. Fine. Let's just continue on this bit actually. Sorry, I thought we were further ahead than we were. So, great. So with this patient, as we said, we decided we came to a decision about what she would like to achieve. And as I mentioned previously, for any patient, few other patients where I think they don't need mid-face revolumization before we start anything else. And these are the little kind of rules and things that you'll learn as you get more experience, but mid-face is always where you should start with these things. So with her, we decided that we do some mid-face revolumization, whereby we were going to do some injections onto the zygomatic arch. In any case, we'd actually did a few other things. We did some lip injections and some injections into the nasolabial area and also around the corners of the mouth. But we're going to have a look just at the procedure of actually doing the dermal filler to the cheek, and then we'll look at the results. Good. So we're going to just see the injections. I mean, this is a long video going through all of the markings and assessment and injections, which again, I'm quite keen to incorporate as much as I can for the ongoing webinars, but this is just an introduction. So we're just going to have a look at the injection of the zygomatic arch using dermal filler.
That's great. And we're going to inject over 3 points. We're going to inject 0.2, 0.2, and 0.1.
That's ml.
The amount that you will inject will depend on your initial analysis of each individual patient. Okay, Juliana, we're going to start injecting now, okay? Any discomfort, you just raise your hand and let us know, okay? I like to ensure that I have the zygomatic arch between my fingers. Stretch the skin back. Sharp scratch. Down to bone. Next up, you move on to aspiration. Holding that for 5 seconds. proceed to inject at 0.2 in this area. Inject slowly in a controlled manner.
Aspiration is incredibly important, and we can discuss that again at a later date for a safety perspective.
Apply gentle pressure. Moving back along the zygomatic arch, we move to the next point. This is around 1.5 centimeters posteriorly. Again, stretching the skin nice and tightly. Sharp scraper, perpendicular, hitting bone. Aspirate. Then inject 0.2 in this area. Gentle pressure. Need to complete the final injection on this side, which will be 0.1. Uncommon for there to be bleeding after these injections. They just require slightly more prolonged pressure over the area. The final injection of 0.1. Again, stretching the skin, perpendicular, avoiding the marking, down to bone. Aspirate.
Okay, so we've seen the procedure. Great. So just going to my video back on. And then we're going to get through to the end of the presentation. And then if there are any other questions, obviously, I can answer them at that point. So you saw the video, you saw the treatment, and then we can see the effect on our patient. So we actually did a couple of things, like I said. We did mid-facial volumization using the volumer here. We also filled the nasolabial folds. We did some filler around the corners of the mouth and a small amount of filler in the lips as well. And if we think about what her objectives were, so she was thinking about, let's just recap, so less tired and more useful. And I think we can safe to say we've actually achieved both of those. And this is immediately after the procedure. And in terms of other things, I think look more feminine as well. So we've got a nice ratio of bigosomatic width with the bigonial width here, which in females should be slightly more than 1 to 1. We've rejuvenated the perioral region as well. And she has a more rested and a more feminine appearance. So, but again, very subtle as well, which again, what I would say in your practice, always try to get subtle results because patients will thank you for it. Okay, just a couple more ones to look at now, not with videos, just to go through them. So here's one where, so basically objectives, wants and needs, patient wants, some patients will come with specific things. They might say, I want a bigger jawline, I want my chin to be bigger, quite common in male patients. But here, I think that we arrived at, I want to look less tired and I want to look more masculine. So what we did was what we call a facial harmonization procedure. which is where we look at the patient, we look at where they may be deficient in terms of wanting to achieve a more masculine appearance, wanting to achieve a less tired appearance. And we treated the under eye areas, the cheekbones, but also the jawline. And importantly here, you can treat the cheekbones, that's fine, but never treat them more than you're treating the jawline, because in a man, you obviously want to create the more youthful masculine appearance. And we can see the result straight afterwards here. And you can see it's quite a dramatic result. And again, looking natural, but it is quite dramatic, and you can see immediately, without actually focusing on any specific aspect, which is really the most important thing in facial aesthetics. Generally, someone would say that person looks masculine when they look at them, more masculine than they did before. And they look more youthful than they did before and less tired. And that's what you want to have. You want to have a general glance at someone and think, wow, you look well, I can't put my finger on it. And that's what we're trying to achieve in aesthetic treatments. I think this is our final case, a slightly more complex case. And what we arrived at here with this patient was actually that they just wanted to look more their actual age, because basically with the morphology of aging, the way it affects skin, etc. This is quite a common thing that we have patients approaching us for, that they feel that they look older than they actually are. And then other things looking more feminine. So these were the objectives that we had with this patient. And I believe we used, we basically did quite a comprehensive cheek revolumization. So a female patient who's had a lot of volume loss, you should invest everything in the cheeks. And we did, I think, out of 4 or 5 mils of filler, 4 of them were in the cheek area. And we used just a mil around the jawline to try and help. And with the cheek, that was divided between the technique that I showed you on the video, where we have boluses along the zygomatic arch. We also moved more anteriorly, because she was quite flat anteriorly, care of the infraorbital foramen. And then we also use a cannula to inject in the subcutaneous plane to basically address the fat pad deficit. And you can see the effect was quite astounding in that, again, generally just look at the patient's face immediately, and from thinking lack of volume, less feminine, etc., immediately think the patient's face is more well volumized, they look more feminine, they look more healthy, they look more rested. In addition, with this patient, we also did some toxin treatment to the upper face. And I think, and so this photo was 2 weeks later, you can actually appreciate the nice effect it's had on the brow here. Can you see? This is the absolutely ideal effect. And this patient had previously complained that she went to Harley Street, the doctor didn't really speak to her, just did Botox, and she got a flat brow. That's the most common complaint that you get with females when you're using upper face Botox. Do not ever flatten a brow. And it needs to be done really safely and judiciously. And we managed to achieve that quite nicely with this patient, actually really well. Softened the lines on the forehead, and then obviously we did the revolumization with filler. So kind of answering that question of the person who wrote before on the Q&As, this is a perfect case of where we would use a mixture of toxin and filler in different areas of the face to create a more rejuvenated appearance. So I'm going to get to the end of the presentation, and we can do some question and answers. So I've added this bit in, which wasn't in the initial face-to-face presentation about COVID-19, because obviously it's taking over everything at the moment. It's having a massive impact on all of our lives. So thing to think about basically is how COVID is going to affect you now and moving forward. So the effect so far has been quite huge, really, on healthcare, on people who are studying at university or doing jobs that aren't in the emergency medical setting. So I'm sure all of you are acutely aware of how big the impact has been. With the disease itself, it's important to have some understanding of the disease. It's an RNA virus, and the areas of the body, the systems of the body it can affect are multiple. And indeed, there's a lot of research going on as to what primary system affected is. In that, obviously, we think of it as a respiratory virus, but the effects on the kidneys and coagulation and the cardiovascular system are all well documented as well. So importantly for you as healthcare professionals, you need to know how to stop spreading the virus, how to reduce the chance of it spreading, how to put your patients at lower risk, how to put yourself at lower risk. And this is really important in aesthetics, but also in general dentistry, because, and until this is definitively resolved, it's going to have an impact on everything that we do. So social distancing, making sure you wash your hands for 20 seconds more regularly, coughs and sneezes, thorough disinfection. And indeed, if you look to countries which are now easing lockdown restrictions, especially in the Far East, who are dealing in aesthetics specifically, we can learn from them in terms of predicting what's going to happen here. So for example, they're having to ensure that there's only one patient in their clinic at any one time. They have to follow a clear disinfection protocol afterwards. They may only be able to treat one patient within a certain time period. All of that's going to have real knock-on to kind of how much profit you can make, how you run your clinic, etc. So it's really important we're thinking about these things for the future. And the effect on training is going to be huge as well. So obviously a lot of training is face-to-face, as it should be. But with things like the level 7 or more regulated training or online platforms, it's really important that you choose a training provider that has an online learning platform that works for you. So for example, if it's interactive, if it's video-based, if you prefer looking at written material, if you're going to have webinar formats, things like that, you need to understand what is going to work for you, because a good amount of any qualification you do in aesthetics, a regulated qualification, will be online learning. So again, you need to see the opportunity of that, and that you may be doing less now than you were before, and it could be a moment for you to actually start training in a different area, whether that be carrying out the online learning component of training, and then carrying out the face-to-face learning when restrictions are more lifted. So I definitely think about where you are currently, where you want to be. If you are interested in aesthetics, think about those things that I've referred to in terms of how you would like to train and what type of training suits you best. So again, just alluding to some of the things I've already mentioned, short term in terms of your practice. So obviously you'd have to cease all non-emergency practice. Consider things like video consultations, or indeed, while we're here today, doing a video webinar in terms of your learning needs. And from a training perspective, use your time wisely and make sure you find a resource that works for you. In terms of long term, again, stuff we've already mentioned, enduring changes might occur. So for example, in terms of social distancing, the way it may affect how you can see patients. One interesting thing to think about is the possibility of COVID being a catalyst for regulation within the sector, in that the government of all colours have been dragging their feet with regard to this. And if, for example, we now have to have government mandated rules which are followed in terms of how many patients we see, who can see patients, upholding safety, possible that this could be a catalyst to actually bringing in more regulation, which I feel would be a good thing for healthcare professionals. So in summary, understand that this industry is a burgeoning industry and market that is open to healthcare professionals. And as healthcare professionals, you are uniquely qualified to work in this industry. Also understand that there are cosmetic and functional aspects. So you might be treating someone with skin issues who has a functional problem. Again, another example would be, which I didn't allude to in the presentation, someone who has mesenteric hypertrophy. So bruxism, grinding the teeth, Botox is used commonly for that. So there's definitely an overlap between the cosmetic and the functional sides. Regulation is weak, but however, I believe that is likely to change, and that has implications for your training. So a move towards more regulated training options, which are going to future-proof your training and your career. And importantly, it's a complex and challenging field. People have an idea that aesthetics is really easy to make money, easy to get really good. I would like to disabuse you of that because it isn't. That's not to say that there aren't huge opportunities for people who are interested, who carry out the right training, who know your anatomy and safety. I believe there are huge opportunities, but having a clear plan is really important. And then just a final bit about the webinar today and the series. It's a proposed webinar series where we can talk about more aspects of aesthetics in depth, so particularly dermatology and anatomy, more detailed facial assessment, go into more detail on individual treatments where we can discuss anatomy, the complications, etc., and also more about starting out in aesthetics. And these initially would be a fortnightly webinar, and it would be a general overview to the fundamentals of non-surgical aesthetics for people who are recently graduated or who are going to graduate within the next 1 to 2 years. So if you are interested in that, if you'd like to talk, obviously I love any feedback. And please do email the email address below, which I can, if you want to just kind of screenshot that, or visit the website as well, where you can also sign up to the newsletter, and then we'll be able to send out registration for the webinars coming up, because they will be limited to 100 people per webinar. So if you are interested, please do get in contact if you've enjoyed the presentation. And then any questions? So I'm going to have a look and see what additional questions have been added here. So I think it's just one extra question actually at the moment, which is, do you do a lateral brow lift? Yeah, the answer to that question is yes. That's quite a common treatment actually. That is sought after, especially when a patient is with age. Part of the aging process results in a reduction in the height of the brow, so it descends, and patients often seek treatment for that. The way that you treat a brow lift, going into the details, but you use botulinum toxin and you inject orbicularis oculi, because as we alluded to earlier, that's a depressor in the lateral brow. So the aim is just to weaken that depressor and just slightly lift up the brow there. Any other questions at all? Referring to it, fine. So yeah, I did do a brow lift on that patient, yeah. That's an example. But important to understand that just by treating 3 areas of the upper face, so around the eyes, the brow, and the forehead, that generally does give a lifting effect overall, because we're paralysing some major depressors, which are the orbicularis oculi and the glabellar muscles. So in addition to that, you can then add an extra small amount of Botox more medially, so kind of moving in a circumferential way more medially, and that slightly raises the brow. But again, that's a slightly advanced technique, so I don't want to go into the details of that now, but yes, that did involve brow lift. Okay, another question. During downtime, due to COVID, do I suggest any free anatomy courses, aesthetic courses, other than this webinar? In terms of free stuff, not so much with aesthetics. There are a few things in terms of anatomy, in terms of apps, etc. Some of them you usually have to pay a small amount, but they're subscription based. So that's one option. And if you want to email me, I can send you a list of things, because on the top of my head, I can't think of the names of them, but there are a few bits and bobs. But with aesthetics, unfortunately, most of the stuff you have to do is paid. And again, I'm making a point of these webinars not being paid, because I know you're undergraduates. So I think it would be useful for you to attend them, because if you're interested in aesthetics and anatomy, we're going to be able to cover kind of individual areas in more depth. And I believe very much that anatomy is at the heart of everything in terms of being a safe and good aesthetic practitioner. So I hopefully look forward to seeing you again at later webinars. And with regard to the downtime now, what I would say is that just because you can't do face-to-face training, or you may be an undergraduate right now, that doesn't mean you can't start the theoretical training with aesthetics. So for example, the level 7 can take anything between 6 months and 2 years to complete, depending on if you're obviously working in other roles. So many people take a long time to complete it, they're doing it in their free time. So starting the theoretical part of that can obviously take place, or indeed using any resources that can help you move more quickly into the area once you do graduate. So I hope I've answered those questions. I've answered them all verbally rather than writing them down. So yeah, if there are no other questions, I'm going to say goodbye. Thank you very much for following the talk today. I hope you found it useful. I really look forward to any feedback. If you could kindly email me via that email, or contact me along the way. And if you're interested in the webinars moving forward, again, do make sure you register via the website, because there will be a limited number. Okay, thank you very much. Bye.